Hey everybody, happy Monday. I am live with UiPath at the Becker event. We're going to talk healthcare, automation, AI, and the future of work with Jason. How are you?
Good, good, Evan. Thank you for inviting me today.
Well, I'm really excited, always excited to chat with UiPath, in particular in the healthcare IT world. That's of interest to me. Perhaps introduce yourself, your role at UiPath, and for those three people who maybe never heard of UiPath, maybe give us the thumbnail sketch.
Sure. My name is Jason Warrelman. I am the VP of the Global Healthcare Practice at UiPath. And UiPath is a software automation company. We're used in more than 60% of the healthcare systems today to really optimize their full enterprise operations, whether it's back office really focusing on revenue cycle management and streamlining the way that they work with payers, processing their billing, their claims, improving that accuracy, including the health plan side, who of course is using it to process those claims and improve things like prior authorizations and utilization management. I would say that if a human is doing it and it doesn't necessarily use cognitive thinking to do it, our customers use our software to fully automate it.
Yeah, that's an amazing mission you have, particularly in healthcare, given the amount of bureaucracy and paperwork. I think I read somewhere you save hundreds of thousands of hours over the last 3 years, and the cost saving the cost of underwriting and claims processing and insurance and healthcare and beyond related areas. That's amazing.
Yeah, actually, it's closer to a billion. Um,
Okay, a billion hours.
Yeah, when you talk about healthcare and the equivalency, I mean, the great thing about software, it doesn't eat, it doesn't sleep. That's what the human needs to do, and we definitely need more of it, right? So if we can put the software to run 24 hours to do these tedious follow-up tasks that we always get in our in basket, whether it's following up with a patient, following up with the payer on a past due claim, these sort of cycles really add on the human, and the human can't do it. We can't swing shift enough. So the robots really maximize that productivity. So almost to a rate of 4 to 1. So it can really scale a process considerably.
Wow, 4 to 1, that's some ratio. Well, you're live. You're from an event at Becker's. Maybe describe the event. It's a really well known industry event in healthcare, really who's who in the hospital and healthcare IT world. Yeah, so where are you? What's the idea today?
Yeah, absolutely. So Beckers CEO CFO Event, UiPath is a proud sponsor this year. Really, we're here to re-advocate a focus back on revenue yield and revenue cycle. The revenue cycle being an entry point, a gateway, as you could say, into automation for most healthcare systems. It's where all the repetitive work is, the non-value exercises. Of course, the payer-provider relationship's always tough. So, we want to try to maximize as much as possible. I would say a lot of organizations have moved towards more clinical automations or horizontal, like contracting or supply chain, which absolutely they should. There's a lot of value there. We got to bring back that revenue cycle management story and start looking at the front end, especially in places where revenue integrity and revenue yield is important around authorization, referral management. These are places that workforce capacity is a big challenge. And today, so far, what we've heard on the floor is workforce is the biggest issue that we still have. So we want to be able to improve that workforce condition. We need the revenue yield. We need to meet the payers at the gate, and the only way to do that is to obviously maximize, our claims, maximize the way we do eligibility, maximize the way we validate our charge capture and do pre-auth. The problem is there's just not enough people to do it, right? We just can't
Yeah.
find these people. So this is why automation is really prime and a key part of anybody's workforce strategy.
So give us some examples of what activities are being automated by UiPath. Where are those efficiencies
Mhm.
being realized specifically? And there must be some very unique workflows.
Yeah, I mean, at any given time, a healthcare system has about 900 potential use cases that they are going to use UiPath with. Now, of course, like any other technology, how fast you can build those use cases are always the issue, right? Because you still need developers. Bots can't build bots yet, unfortunately. We're getting there. But some of the key areas that right away, again, it's sort of that interoperability between provider and payer. Can we look at eligibility? Can we pull benefits? Can I pull those ERAs when denials happen? It's just being all that work that we do between the provider and the payer that maybe an exchange can't handle right now. Requests for clinical necessity documents. These are things that humans have to do because there's a portal I have to access. There's an SPT portal I have to access. It's just this interoperability engine. So normally that's the biggest lift that we see immediately on day one. We call those low-hanging fruits. And typically an organization is going to look at about a $3 to $5 million in annual savings, and that's pure productivity. That's not until we get into AR cash flow, which normally we see at least 1 to 2 days of DSO resolved. Well, then you start to get into more complex places, which, you hear AI, what's great is UiPath, amongst other technologies, are now lowering the barrier to entry into these more advanced, intelligent use cases. Where it used to be really difficult to kind of mash them all together. Now UiPath has it all integrated together, so I can stretch it. So now can I do prior authorization, right? And be able to balance ambulatory and inpatient? Can I do pre-claim edit and audit to make sure that all my modifiers are reconciling correctly? Can I then look at some more upstream and look at my provider MPI and make sure all those are updated so the payers don't deny based off provider subsets? So there's a lot of processes that I would say were kind of on the backlog of a hospital's automation program that they're bringing up front because the art of possible is now really the science of practical. And that's just
I love
the
that.
revenue cycle management area. Like I said, we're used across the spectrum. We're used heavily to manage and drive just-in-time supply chain, balancing financing and approving credit memos and adjusting those so you don't have those balances that are open. All the way down to, of course, like I said, talent acquisition. It's hard finding people, but getting people in the door and getting them access to their system, like providers, as quick as possible so they can be revenue generating and put onto insurance. That's the key. Some health organizations lose doctors and administrators in the first 90 days because they don't have access to their EMR, right?
Wow.
So being able to shorten that time period to talent acquisition onboarding is I would say has been one of the largest use cases for UiPath in general this year across all industries, especially healthcare.
Yeah, and I think I know, healthcare systems, hospitals are under extreme financial pressures,
Mhm.
and this is about, financial outcomes as well.
Yep.
I imagine there are a few CFOs there with a keen interest in this technology. What do you say to them?
Yeah. So CFOs are typically who invest in UiPath initially, really
Mm,
any automation program. Normally what they're looking at is how do I address risk? Risk is
mhm.
really important, right? Risk to revenue, risk to investment. So you really want to make sure that they understand what their ROI is going to look like from an automation perspective. And it's great because we just look at people and say, what if I can give you 4 times, 5 times the staff and make it run? So typically the ROI is really strong because you're talking about thousands to make back millions. That's a pretty good margin.
Mm.
But then it's what can it do and how can it improve things like revenue yield, which is what we're talking about here. So can I take a complex 40-page referral, stick it inside a robot, and then have the robot automatically adjudicate eligibility, benefits, pull all that data together, and be able to actually drive a response back to that referring physician, being able to accept that patient in for that procedure. That timeline saved is pure revenue because organizations actually lose revenue when they're not the preferred surgical center or they're not the preferred laboratory site.
Mm.
So reducing that cycle time absolutely improves patient outcomes, obviously from a health perspective, but more importantly, brings more revenue into the health system. So those are two of the things that they hadn't seen prior with automation that we're showing them here today.
Oh, fantastic outcome. And it's more than just the automation tech. You're very involved in areas like analytics, providing, unique insights as well as compliance, particularly in healthcare. How does that all wrap around the design of a workflow or new process that you want to automate?
Yeah, so UiPath used to be very just robots, right? Which
Right.
is compressed navigation, minimize the number of clicks, which everyone wants. But then we realize there needs to be a way of knowing what I need to automate. So can we now bring business intelligence, right? So business intelligence to understand how your operators are managing inside the system, to know if there's even an opportunity to transform the process, because transformation is really what you want to do with automation, right? I don't want to click, 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 click. I want to look at the whole thing in general and say, can I eliminate, let's say, an audit task? Here's 800 people that do audit. Can I fully automate that process? And then what happens when I can do things in parallel and not consecutive? So these sort of questions we want to answer, and we use business intelligence with high-powered AI to look at how the system operates, how people operate, and then actually recently how communications operate. So can I look at in-basket communications? Can I look at cases coming through email? Can I look at the supply chain email from vendors and look at POs and actually aggregate that intelligence of what those communications are for, and then instantly connect robots to take action on it in a safe, compliant way? So insight to action is a whole book of what UiPath does, aside from automating, and then the various ways of engaging an internal constituent inside the health system on actually using those robots. Most don't realize that automation is running in the background. Some do because they do a direct human in the loop. For compliance reasons, we might want humans to click the final button or make a final decision, which is what humans are really good to do. So there's a whole subset of the way you engage with robots as well.
Wow, that's so exciting. Well, it's fascinating. When I started really following UiPath closely 6, 7 years ago, it was all about automation. And now, I mean, you guys are in data analytics, big data, AI as well. It's just really impressive to see. And let's not forget the patients in all this process, which of course you're not. I think patient experience is also a key outcome, I think, through intelligent automation. What are some of the impacts that you've seen on the patient side?
So what's great is if it's working correctly, the patient doesn't even know robots are happening.
Mm.
I mean, it's like anything else. I just want to be able to get what I need. So a lot of patients access the health system through either a phone call directly at the front desk, or of course through some other mode. It could be a MyCharts app. A lot of times automations on the back end, solving interoperability issues between these systems, closing data gaps where, maybe there's information I need to get into MyCharts. There's no good way of making that integration. So people are copying and pasting. Great use of things like automation, right? Or improving things like self-service, calling in, and then the robots working with an IVR to aggregate information. I think one of the biggest pieces I've seen recently with, really the patient is actually following up on
Mm.
procedures or tests they've done. There's a large number of people that actually don't follow up in their MyCharts or have a MyChart system, an app that gives them an update on a test. Most
Right.
labs are negative. Thank God, most labs are negative, right? Or there's an insight that you want to share with the patient to give them transparency. A lot of times there's a care gap reason why we need to talk to the patient about a negative and a positive test. So you have a way of doing outbound. You have the test, and you have task system, right? Depending on your EMR or EHR, but there's not enough people to make that outbound call to the patient, right? Or
Mm.
it's days later when the patient needs it, especially if there's a test. Think about all those negative COVID calls that had to happen over the
Mm.
last couple of years. So we're seeing now the combination of UiPath with those various different systems to orchestrate an outbound call to a patient. So again, very administrative, right? You need a whole army of people to kind of take a list here, put a list there, pick up the phone and call someone. The technology all exists in the health system. It's now using automation to orchestrate it all to improve that patient experience. So most people wouldn't think of automation as being an orchestrator, but in reality, when you sit back and look at most of the administrative staff that is non-patient facing, we're all orchestrators, right? It's a big part of what healthcare administration does, is the orchestration of the patient journey. So we're just taking that orchestration and moving it to a digital outcome.
Well, it's so exciting. You've been in the healthcare IT space your entire career, I see. I love your
Most
tagline on LinkedIn, bringing healthcare back to the future. Um, you must get a lot of satisfaction in your role at UiPath and the way you're helping transform customers, clients, and partners.
Yeah, absolutely. I come from a traditional black belt consulting program. I've been helping
Mm,
organizations transform their business for over 20 years. Uh, a lot of times in programs in healthcare, it was less about how to optimize the technology and how to optimize the way people work, right? And then, you know, in recent years, right before I joined UiPath in 2018, we started to see this emergence of automation. And I really saw it as a gateway of really accelerating the transformation that my teams were spending years on delivering. And the cost was marginal. Like I had some programs that were running, 10, 15, $20 million over budget trying to build an application, whereas we were able to solve it with automation in 3 months for $85,000. So that was
mm,
really appealing to me. And I could just think of the opportunities in the health system. And that's what ultimately led me here. At the very early days when automation was a brand new concept and most CFOs and CIOs really hadn't considered it. And obviously, we're in a very different place 5 years later, seeing that automation is a part of every CFO's agenda, and from our perspective, working with 60% of the largest health systems in the world. So it's been really gratifying, and seeing the new use cases that they produce every year is really inspiring. I mean, to say we have 1.7 billion digital workers out in the healthcare space is really gratifying. I mean, if you look at kind of cost factors, I mean, it's quite significant. It's hard to equate sometimes, but if you think about the iron triangle of cost to quality, I mean, you're talking in the hundreds of billions of dollars. I think the last time we equated was about $500 billion in savings that we can add on the back of the napkin from customers. I'm sure it's quite larger than that at this point.
Well, it's an exciting time, and you're right at the forefront. And with AI, it's like we're just getting started all over again. Hence,
Yep.
back to the future with real and practical implementations of AI in health. Everyone, take a look at some of the recordings from the last UiPath Forward event. Really revolutionary new offerings and innovation coming from UiPath. You must be like super pumped, to say the least.
Yeah, super pumped. What I'm recommending to everyone is look at the practical uses.
Hmm.
We love the big ideas. I
Yeah.
like the art of possible. That's why I say the science of practical, because automation really takes very complex technologies like AI and make them practical, right? Insights to action is really the key. I love the generative concepts of a lot of the products that are out there, but you need to make sure the data is right, and you
Hmm.
need to make sure once it generates, something happens. We don't want to generate more work for people. We want to alleviate the work for people, right? So you really need to think about how to combining those technologies together to create a practical outcome, and that's what we're really focused on right now. So, where everyone's really worried about data governance and compliance, when today, what would you do? You put a human there, and the human would validate the compliance and governance of something like an AI model. So we're letting the robots with the human be the wardens of that technology, and then we're running that front end data quality and that back end action to create a really useful, practical outcome. And some of these use cases are already implemented, but now we're teaching these robots new tricks, right? Or we're taking a very complex use case, like I said, around prior authorization, or maybe on the other side, utilization management. And we're taking this massive 9 to 12 month program and shrinking it down to 4 months because now we have generative AI that's kind of democratizing NLP. So it's just really exciting to see customers get excited about use cases that were sort of a maybe to an absolute must.
Well, thank you so much for sharing your insights there for live from the floor. Have great discussions and meetings, and we'll look forward to a bit of a debrief once you're back at home base. Thanks so much, Jason.
Thank you. Appreciate it, Evan. Thanks again. Come see us at booth 400.
Booth 400, and thanks everyone for watching. Reach out to UiPath with any questions. They're great on social. DM them, engage them. They have so
Yep.
many interesting insights to share. Take care, everyone.